Talking in this main room all together about some of the shared benefits and information between all four programs, just as a university, just things that we all share. And then after that, we'll go into breakout rooms. So you will be able to select for which program you're interested in, and each program will have their own presentation of some information that's specific to their programs. And then a Q&A with either a current resident or a recent resident alumnus. Um, Along the way here, if you've got questions that are sort of just overarching, broad questions, not specific to one program, feel free to enter them. I know it says chat on the slide, but enter them in the Q&A section. I believe that should be available to y'all. And then if it's a program specific question, we'll save it until the breakout room so the program coordinator or director can answer the question appropriately. All right. One of the big reasons why folks consider residency programs is clinical mentoring. So I wanted to spend a little bit of time talking about how clinical mentoring is structured for us here at UCSF. Um, the number of formal mentors varies program to program, with acute care having 6 to 7 formal mentors, our neuro program having 4 to 5, ortho 3, and women's health 3 to 4. It's not to say you might not also have some other guest mentors along the way, but you kind of have this set number of faculty to be close with during the year. This regular mentoring allows for check-ins, goal progression, and growth. Our residents do pick which patients they would like to be mentored with as far as follow-ups go, and obviously new patients are sort of a surprise for all of us who ends up on our schedule, but within the discipline, of course, that you're focusing on. Mentoring does give time for feedback and reflection, both written and verbal, and this is feedback and reflection by the resident as well as the mentor themselves. And then given that UCSF is sort of a major medical center, big hub, we do see quite a few complex patient cases. So our residents tend to see a really diverse caseload with a big range from simple to complex. So I think weigh that in your decision for coming here. I think you'll be able to see some really cool cases in all of our programs. As far as benefits go, I've highlighted a few of these in yellow, which are a bit more unique to UCSF and then some other programs. So as a university, our residents are eligible for on-campus housing, which makes housing in a relatively expensive city a little bit more affordable, as on-campus housing is at market value or lower, and also tend to be pretty conveniently located near either where you work or near a shuttle stop to get you to work and campus a little bit easier. A little bit more typical health, dental, vision, life, disability insurance. We do offer 20 days of paid time off, which I think tends to be slightly in the higher end versus other programs. For ortho, neuro, and women's health, we do schedule a winter, spring, and summer break. So 17 of those 20 days are deliberately scheduled out. And then there's 3 discretionary absences. And I'll let the acute care folks in their breakout room talk about how they handle their 20 days of PTO as well. We do offer 5 days of paid continuing education leave in addition to this time off, and then $500 continuing education money for conferences, etc. And then for 3 programs that have a specialty exam, ortho, neuro, women's health, we do offer $800 towards the OCS, NCS, and WCS respectively upon completion of the program. And then again, as a large institution, we do have quite a few continuing education courses come through here. So they are either offered free or at a discounted rate to our residents while they're here with us. A unique feature is we offer $250 per month for meal cards for campus restaurants and a cafeteria. As far as I know, I think we're the only set of residency programs that does this. I don't know other places that do, but we want our residents well fed and caffeinated while they are here with us. And then we have free campus shuttles, again, because UCSF has multiple campuses across the city. And those shuttles also go to BART, et cetera, to make commuting in a little bit easier. And those run Monday through Friday. New this year is we're trying to promote abstract presentation, and so we're covering submission fees, whether you want to present your case or quality improvement project at CSM or CPTA, et cetera. So our department's going to support that moving forward, as we're really hoping that most of our residents will look to do this while they're here. And then we also offer a relocation stipend of up to $1,800. This is a benefit for those that are not already currently in our DPT program and outside of the Bay Area. So to support folks from external programs to apply here and have some financial assistance to move to the Bay Area. And then you can see our salary listed here at the bottom, 94,777. That will be the salary for next year. All right, now's the time to pull out your calendars if you don't already have some of these dates saved. So our application cycle is open on RFP TCAS for this year. Our acute care program, your application is due on March 1st, and for neuro, ortho, and women's health, it'll be February 15th. All programs try to invite folks for an interview by mid-March, and then if you don't get a chance to write down these dates, don't panic. You can head to our website. If you go to ptrehab.ucsf.edu and then click on the education tab, you'll find out all the information and more in a frequently asked questions section too about our programs. As I mentioned, we see a pretty broad population of patients, and so we would love to train a broad population of physical therapists while they're here. So we do strongly encourage everybody that's interested to apply, including clinicians from medically, economically, and educationally disadvantaged backgrounds in order to reflect the needs of our populations here. And then a little shameless plug here. If you are not already licensed and have not already taken the NPTE exam, please consider taking the April exam if it is something within your program you qualify to do. The reason for that is that if for some reason, and we're not wishing this upon anybody, but if for some reason you don't pass that April exam, there's still one more chance to take that July exam and still enter our residency programs. We have had folks in the past that didn't take an earlier exam and then didn't pass the July exam, and then were not able to start with their cohort in September. Any questions about any of these benefits? Please drop them in the Q&A section now. Happy to answer those here. Otherwise, we'll move to breakout rooms if you've got more exciting questions for the programs themselves.